Hi, this is Elliott Martin,
And I'm Becky Hatfield.
and we're coming to you from opposite ends of the country today to talk about Medicare
We're asking,
and answering all your questions related to Medicare so that way you can make an informed decision. This is the Medicare Navigators Podcast.
he used telehealth to call in a prescription for Tamiflu.
You've got this rule called the birthday rule. Best way to apply for Part B, walk in your documents.
There is like a black hole in the Siberian wilderness where paperwork goes to die. You have been hearing some feedback recently that people have been getting quicker turnaround time from going into the Social Security to turn in their documents, like physically going to the Social Security office. Is that true?
Yeah, so certain situations where extra documents are needed to be submitted to apply for Medicare. So if somebody's turning 65, really the easiest way to apply for Medicare is online. And you can start that process if you are applying for Medicare at your 65th birthday. You can start the process 90 days before your 65th birthday month. So you got 3 months ahead of time. I would suggest starting that process as early as possible. For the most part, individuals can get approved usually within like a week's time. You can get approved, but if there's any sort of extra documentation they need, you want to give them more time to let you know, and two, for you to get that documentation into the Social Security Administration. What the more specific thing that I'm seeing is for individuals who delay Part B of Medicare. So if somebody's still working and you have insurance through your employer, a lot of times you can delay Part B of Medicare penalty free, as long as you're still working and covered by your employer group insurance, or maybe you're covering a spouse. Same thing, your spouse can delay Part B. For those individuals who are now retiring, maybe they're age 67, 68, as they go to apply for Part B, there's two documents they need. One document needs to be signed off by their employer. It's called a request for employment information form that they have their HR benefits manager sign off on. The other form is called a Part B enrollment form. So when those individuals have those two documents, what I'm seeing is the quickest turnaround time is for those individuals who are willing to walk into their local Social Security office, see somebody in person, take the morning, wait an hour or wait however long to see somebody, hand those documents into a live person right in front of you and have them take a look, make sure everything looks correct, and process those. I'm seeing 48-hour turnaround time, which is amazing. That's amazing for Part B, because I've had other individuals who have, and this really, I think, became more prominent over COVID, is there was an electronic way to submit your Part B application and send in these documents electronically. For some of these individuals, Social Security is telling them 60 days waiting time. You've got to give Social Security 60 days. In 60 days, you can check back in if it's still not approved. And unfortunately, I'm having individuals who are waiting the 60 days, still no turnaround, still no decision. So that is the issue. If you're not, if you're submitting it other ways, we're at the mercy of the Social Security Administration to properly process those in a timely manner. And, sometimes they can't, right? So if you are in a position where you need to activate Part B, you're going to be retiring, you're over age 65, best way to apply for Part B, walk in your documents, see somebody in person if you can, right? That would be the best way, quickest turnaround time.
I think that there is like a black hole in the Siberian wilderness where paperwork goes to die,
Yeah.
because I was trying to get some medical records for one of my kids recently, and I think this was in October. I sent in all this paperwork that I worked so hard on, and it was supposed to be like a month turnaround. I still haven't gotten a
Oh
response
my.
on these
Yeah.
records. So I had to go physically to the doctor's office and kind of act a little bit mean and say, I need
Put
this
the foot down,
paperwork.
Becky. Put the foot down.
I had to go mama bear on them. And
Yeah.
And sure enough, like right then and there was some
Right.
shuffling and kerfuffling, but they got it done right in front
Yeah.
of my face. And
Yep.
so I think in so many ways, it stinks to have to go in person to certain places, but sometimes it really is the most efficient way to get things done,
Yeah.
especially when it comes to paperwork, which
Yep.
is annoying.
Yeah, and I think I don't know what it is, but there's just something about the pandemic that, now service, and I think I hear this a lot, is service is just not what it used to be. There's just not as much attention to detail, and it's harder to get quality service for people who know what they're doing and can help you in a timely manner. It's I think harder and harder to find all across all industries. Right?
Yes,
So,
I
health
think you're right.
insurance and medical, it's not unique in that sense, I don't think. So,
No, I'm trying to do my part with my 3 kids. Every time we go somewhere, I say, "Does that person have good customer service?"
mhm,
And my kids have to tell me in the car afterwards, like, "That person did have good customer service,
mm,
mom,"
yeah,
or "They did it," because I'm trying to raise them to be people that someday when they're out serving the public in different roles, that they
yeah,
actually know how to look people in the eye and
there
treat
you
them with
go.
respect.
Yeah,
So, hopefully there's a new
awesome.
generation coming that knows how to be kind and have good customer service.
Yeah, yep,
So I wanted to ask you about Medicare Advantage because I know that there's been just some dissatisfaction with people in realizing that, oh, I didn't know I had all these extra benefits. No one made me aware of these. I didn't know I could have I didn't know I could go to the gym for free. I had vision coverage.
mm.
So Congress has been working with the Medicare Advantage space and trying to create some reform. Do you know of anything that's been changing there?
It probably would be a good thing, for people just to understand the extra benefits that they qualify for, on their Medicare Advantage plan. If so, on these Medicare Advantage plans, a lot of them go above and beyond the normal Medicare standard benefits, right? So Medicare, the federal Medicare program, kind of has a list of all these different services that medical providers can provide to their patients and get Medicare to cover them. But there's things that go, that are kind of outside, that are somewhat related, that these Medicare Advantage plans kind of bring in as extra benefits. Things like vision for eyeglasses or contact lenses, hearing aids. Hearing aids are not normally covered by Medicare. Some dental work. There's some great Medicare Advantage plans that will, give you a reimbursement for dental, or things like gym membership. Gym memberships, a lot of times, are covered, or over the count. You can order over the counter items. There's transportation to and from doctor's appointments. I think there's even been some that give recipients grocery benefits. So there's all sorts of different angles different insurance companies on the Medicare Advantage side are taking, to try and attract more individuals, to their plan, because that's really where Advantage plans make their money, is when they get lots of members into their plan. It's this per capita, per person, basically, fee that they get from Medicare to take on Medicare Advantage recipients, or to turn Medicare recipients into Medicare Advantage recipients for that specific plan. So if you don't, a good way to find out what your extra benefits are is request a summary of benefits for your plan, your Medicare Advantage plan. Contact your insurance company, contact your agent, and get a copy of your summary of benefits or benefit highlights. And on those, it'll list out all the extra benefits. There's some that will include Fitbit, or like a tracking device, for your steps, a step counter kind of thing. So there's all sorts of things out there. It's just a matter of figuring out, okay, what is my plan offering? What are the extra benefits that I'm not aware of, that I'm missing out on?
Do you
Yeah.
know anything about whether or not Medicare covers telehealth? Do you hear your clients using telehealth benefits at all?
Yeah, I do get some that do want telehealth. Let me actually pull this up here because telehealth, but prior to the pandemic, telehealth really wasn't a Medicare approved service. And I think a lot of it had to do with state laws and where doctors were licensed basically. Today, Medicare, let me pull up on the Medicare site. And by the way, whenever somebody's curious about a particular service and whether or not Medicare would cover it, go to the Medicare.gov website. So through the end of this year, you can get telehealth services at any location in the US, including your home. After this period, you must be in an office or medical facility located in a rural area for most telehealth services. Okay, so you may have to go to a facility to do a telehealth appointment, I guess,
Mm.
after December 31st, 2024. There's going to be limitations after 2024. So it seems like right now you can still get telehealth services covered and Medicare Part B will cover it just like you're in person, it seems like.
Okay.
Yeah.
I would say burn that up
Yeah.
because, man, that is handy. We used it for the first time recently. My son had the flu,
Hmm.
and my husband was thinking it was close to Christmas time, and he was
Mm.
thinking, we're all going to get this.
Yeah.
And so he used telehealth to call in a prescription for Tamiflu just so that we could have it on
Yeah.
hand
Yeah.
in case one of us went down. And
Yeah.
so it was just so nice to not have to go to the doctor's office and be around more germs and,
Right.
and so it can be super handy, especially if you are in a rural area.
Yeah.
So
Oh yeah, that's a huge benefit. And yeah, right. You don't want to be spreading things while you're sick and contagious, right? So
I
that just
know
makes a lot of sense.
it is a great service.
Yeah, but I think at the end of the day, the big rub against telehealth, I think it comes down to the dough, right?
Use it while you can.
Yep.
So, what is up with all these calls from clients that y'all have been getting in the office about being charged high prices for their prescriptions in the new year? What's going on with that?
Yeah, so I think a lot of times we forget that at the new year, if we have a deductible on our plans, and right now it's really a lot of times we're getting calls for prescriptions because people are going to the pharmacy and getting this sticker shock of, hey, why all of a sudden is my prescription now, they're asking for $500. Why is that? Well, a lot of the prescription plans, there's a standard deductible of $545 this year. That has just reset January 1st. So if you have any brand name medications or any medications that are subject to your plan's deductible, and your plan does have a deductible, that is really the main reason why we're seeing or why people are seeing this high cost up front. But usually once your deductible's been met, your copays go down pretty substantially before you get into the donut hole or the coverage gap. So there is usually relief right after the deductible, but once again, if you have those brand name, high retail price prescriptions, yeah, we're going to have to meet that deductible to then get a break on our prescription. So that's what we're seeing, and it's just a matter of remembering, okay, it's not permanent. It's usually just a one-time deductible that we're having to meet, and then after that, we should get a good break on our prescriptions. So that's
Okay,
basically what it is.
got it. So if someone got they went to the pharmacy and they were charged $500 because they hadn't met their deductible yet, they would probably have to pay the $500, but relief is very soon in sight because once they hit that ballpark 545 threshold, then the insurance takes over, correct?
Right. Then your insurance kicks in and you'll have, depends on what tier the prescription is. If it's a tier 3, okay, now after your deductible, maybe you have a co-payment for that prescription of $45 for next month, right? So it just depends on the plan. But in most cases, there is a break after the deductible.
Okay,
Yeah.
that's good to know. Um, Perfect. So the Part D prescription plans reset January 1st. So you guys have been getting a lot of calls because people need to meet their deductible before
Mhm.
the insurance kicks in. Is that also when Medigap plans reset is January 1st?
Yeah, that's a good question. So the answer to that is yes and no. Yes, in the fact that if your plan has a deductible it does reset January 1st. So a lot of our clients have a plan G, Medicare Supplement. So their 240 deductible this year has reset January 1st. So the first time they go to the doctor, or maybe it's physical therapy, first outpatient service basically on the year, they would pay the first 240. Okay, so that is January to December. That resets at the end of the calendar year. But one of the things that is a little bit off on the Medicare supplements are the premium renewals. So premium renewals for the Medicare supplements, which is kind of odd that they do this, but the Medicare supplements just go by, or Medigap plans as well, they're called, sometimes go by different rules. And each state's a little bit different. But your premium for a Medicare supplement can actually change on maybe on your plan anniversary date, or maybe the plan renews their premiums at a different month throughout the year. So for example, there's really three main carriers that we go with for Medicare supplement plans, at least in California. One resets March 1st, one resets June 1st, one resets July 1st. So we get these new premiums kicking in at different times of the year, which kind of throws people off. Hey, why all of a sudden mid-year like this am I getting this higher premium? Well, it's because, they go off of a different 12-month cycle. So that's one thing that kind of differs on the Medigap plans, the Medicare supplement plans, is that the premium renewals can be off, but the normal deductible, your 240 deductible, that resets January 1st, each January 1st. So it's kind of a yes and no answer to that.
Okay. If you ever needed any other reason that you should talk to an independent agent about Medicare, it's just that right there. I mean, all the dates, all the times, I just, it is so
Yeah.
hard for me to wrap my mind around. And so it
Yeah.
makes me thankful for people like you that it's literally your job to keep track of these things. And so
Yeah.
just,
It's not easy for just, for somebody who's not doing this every day. You've got to know when you need to switch to Medicare. And then after that, when can you shop your plans? And every state's different too. So, California, for example, Becky, we've got this rule called the birthday rule, where
hmm,
our clients can actually change their Medicare supplement within 60 days of their birthday freely. But if you're in Arizona, I don't think you have the birthday rule. Maybe other states, Nevada, Oregon, Tennessee, there might be one or two other states out there that have a similar birthday rule. But
hmm.
so it also varies depending on your state. So it is a good idea. And of course, we would like people to work with us as their independent agent, but there's a lot of help out there. And those are the kinds of things you can benefit from if you do work with an agent that knows the rules, knows the laws, and knows them for multiple states as well. Yeah.
Exactly. Yeah. And I think the thing that blows my mind that I didn't understand before I started working for Martin and Associates is that it doesn't cost to work with an agent. It's it's basically free for you to seek their advice. They don't get paid by the individual, they get paid by the insurance company. And so that
Right.
kind of eliminates all barriers to seeking counsel.
Right. Yep. There's no extra cost. So, I mean, it's already factored in. Obviously, the insurance companies have to factor in, okay, this many number of recipients are going to come from independent agents. So we have to factor that into the premium. But if people work directly with the insurance companies, you pay the same exact premium as you would working with an independent agent. Somebody who can provide you personalized service based on your need, and that you can consistently call and build a relationship over the years, right? I mean, if you've ever called the insurance company, how many times do you get the same person on the phone? It's
Never.
never, right? You get a different person on the phone, and maybe sometimes, but maybe there's actually calling the insurance company, some service reps for us as agents, I sometimes get the same person, but it's pretty rare even at that level. So that's kind of the difference between just doing it. You can do it on your own, go direct, you pay the same premium, or you can work with an agent, get personalized service, somebody who knows the industry, who understands the rules and the laws. Those are the benefits, right? Just having somebody in your corner to help out.
Yes, it's so nice to be able to have someone that can go to bat for you if you have questions or if something doesn't make sense, like you go to the pharmacy and you
Yeah.
have to pay so much for your prescription and you don't know why. And instead of actually calling like the insurance company, you can just call your agent, which
Yep.
you're going to probably get better service. So
Yeah. In my
Yes.
opinion, yes.
Yes, exactly. Thank you so much for joining us for another episode of the Medicare Navigators podcast. We have a weekly Medicare 101 webinar that we would love to have you join us on. Go to our website at www.martinmedicare.com to reserve your spot today. Please join us again next week as we continue this conversation. All information related to this episode is listed below in the show notes.